Hello, this is your host Varsha Singh on Healthline on TV Asia Telugu channel. Thank you for watching our show and showing this loyalty and sharing this journey with me about alternative, holistic, complementary, and natural therapies that give us an opportunity to improve our life by taking all these tips and making changes, positive changes that can lead our life towards a better journey. In this special series of alternative and integrative medicine, I have had opportunity to talk and interview with so many experienced and very well-known healers who have embarked on their own journey of a very specialized medicine. In last two episodes, we talked about Ayurveda. Ayurveda is the ancient science of healing which originated in India. Now it is being practiced all over the world. If I have to quote Buddha's a quote, your body is precious. It is our vehicle for awakening, so treat it with care. This is what Ayurveda brings us, the science of natural medicine. So, what do we have today? Today, I'm interviewing a very experienced, knowledgeable Vaidya, which is, in other words, physician, a doctor, an Ayurvedic practitioner also known as Vaidya. Vaidya is a Sanskrit terminology which means a doctor. So we have with us Vaidya, Dr. Priya Baala, BAMS, MSc, LMT, DYN. She has been practicing Ayurveda in United States as well as India for past 20 years. She completed her BAMS, that is Bachelor of Ayurvedic Medicine and Surgery degree from prestigious Dr. MGR Medical University, which is in Tamil Nadu, India. She also has graduate degree in psychology from the University of Madras, India, and she also has diploma in yoga and naturopathy. So she's an all-rounder. She didn't stop at that. She also studied acupuncture and acupressure in CBIATC, Beijing, China, which is a WHO, that is World Health Organization accredited institute. Dr. Priya's unique approach to health integrates the ancient wisdom of Ayurveda, Marma. Yes, remember this term because this is something she's going to talk about. Marma are energy points, acupressure, Siddha with naturopathic cleansing, healing and relaxation through yoga and meditation. So she encompasses everything when she's treating a patient. She is affiliated to SKY, that is Master Simplified Kundalini Yoga, New Jersey chapter of APNA, that is she's membership director, which is Association of Ayurvedic Professionals of North America. She is also on WISE as research scientist. WISE is World Institute of Scientific Exploration, which is in Maryland, USA. And she is also part of IUYA. She's a faculty at International University of Yoga and Ayurveda, Salt Springs, Florida. So as you can see, Dr. Priya Baala is probably based in New Jersey, but her practice, her expertise, and her knowledge sharing is across the globe. Now, I want to take this opportunity to thank you, Dr. Priya Baala, for joining us on Healthline TV Asia Telugu channel. So welcome, Dr. Priya Baala.
Namaste, Varsha.
It's really a great pleasure to have you on this show.
Thank you. Thank you. Namaste, Varsha, and namaste, viewers. And thank you, TV Asia, for organizing such a wonderful program and bringing all these good things to our community, because there is so much in integrative medicine, Ayurveda, homeopathy, naturopathy, acupuncture, and so many systems. And thank you, Varsha, for bringing all these systems into light and more closer to our community, so um, people can use it for the betterment of their health. Namaste, namaste again.
So, namaste, Dr. Priya Baala. Um, our goal is to share those knowledge about different types of practices with our viewers, so that they can take this actual fundamental knowledge of what is Ayurveda. We are aware that there are so many modes of medicine which are being practiced all over the world, but the common lay people, they may not have the in-depth grasp of what exactly it is and why do I need to look at this source of medicine, what are the benefits, and how I can incorporate Ayurveda with modern medicine, because it's always complementary or adjuvant, or you can probably choose just one mode of treatment versus another. So this is an effort to bring knowledge to common people so that they can make a choice. So to begin this, I would request you to start our interview with the fundamentals of Ayurveda and share your expertise with our viewers.
Yes, that is a very good start. Ayurveda is all about whole person healing. So, the whole person healing is very important because it doesn't take only the physical into consideration, it takes the spiritual and the mental as well. Because without the mental and spiritual involvement, the healing is incomplete. So, Ayurveda encompasses all these three layers of healing, so it is complete. So that is one thing. And the fundamentals of Ayurveda. So our body is made up of five elements, and the five elements are further condensed into three doshas, which is Vata, Pitta, and Kapha, which you have heard a lot in the last two episodes. And when these three elements are in balance in our body, then it is considered to be health. And if there is some imbalance in the three doshas, then it is considered to be a state of imbalance or dis-ease. So simply the body and mind are not at ease. And when we come to the manasika doshas or the mental components, there are three, which were sattva, rajas, and tamas. So sattva is the well-being state of the mind, and rajas and tamas are the slightly imbalanced state of the mind, which we want to bring it to balance. So when the three doshas of the body and the three doshas of the mind are in complete balance, that is the state of well-being, and we want to focus on that well-being in Ayurveda. And there is something called the elimination factor also. So there are three malas, and we eliminate the toxins in our body through sweat, urine, and feces. So if the elimination is not proper, then also the health is being affected. So that is also one of the focuses of Ayurveda. So we achieve this through correcting the digestion process first.
Very well explained, Dr. Priya Baala. We are addressing imbalances. So I have heard that our body is made of Pancamahabhuta, five elements, as you said. And that brings me to question, when we talk about Panchakarma, right? Many people just hear this terminology, but they really don't understand what is Panchakarma. So why does someone need Panchakarma treatment?
Okay, that is a very good question. Panchakarma is one of the basic treatments in Ayurveda, and every person needs Panchakarma at least once a year. I'm going to tell you why. Even though a person does not have disease, meaning they don't have any issues with the blood work or a scan or anything, and the physical examination shows nothing, there is something the person feels. The person says, I don't feel really well. I feel heavy, or I feel bloated, I feel hot, I feel cold. And your temperature, the thermometer would show a normal reading, but still everything there in the records shows this person is normal, whereas the person themselves doesn't feel so. So this problem we come across every day. So here what happens is there is a lot of ama in Ayurveda. So in the last class or last sessions, we saw the focus of Ayurvedic treatment. So the number one focus of Ayurvedic treatment is elimination of toxins, which is called ama in Ayurveda. The number
Mm-hmm.
two focus of Ayurvedic treatment is strengthening the digestion. Three is balancing the doshas, and four and five are stress relief and rejuvenation. So these five are the focusing points. But the first one is elimination of toxins. Why do we need to eliminate toxins, and how do we know that we have toxins in the body in the first place? Right? So that answers your question, why Panchakarma?
Mm-hmm.
So these toxins accumulate over a period of time. And when we are very young, the elimination process is very good. The digestion is keen. So whatever we eat, drink, or inhale, the body can effectively eliminate by itself. But as we age, our organ systems slow down,
Mm-hmm.
right? So um, we have to be careful in what we eat, what we drink, and also there's no control on the air we breathe, right? So the
Mm-hmm.
toxins keep on accumulating, and the organs are uh, not in a good capacity to release the wastes effectively. So over age, the organ systems become burdened, and that is why we call like sluggish liver and low digestion, and we have so many symptoms that can range from high blood pressure, digestion issues like acidity, heartburn, bloating, and indigestion, body aches, mental fog. All
Mm-hmm.
things can come from accumulation of toxins. So in order to keep the person healthy, we need to periodically cleanse. And that is where Panchakarma plays a very, very important role. Uh, so there are five types of actions we use to cleanse the person. And it depends on which one the person needs the more. So
Mm-hmm.
the five types of actions are called Panchakarma.
Thank you
Um,
so much for explaining that.
mhm,
When you were describing Panchakarma and when you said everyone should have it at least once a year, and
mhm.
I'm sure that there are some people who may need it more than once a year. It almost I was thinking of how we clean our house. You know,
Yes.
we remove the cobwebs and we clean everything. We call it spring cleaning here. But in India, you know how we clean the house around Diwali, because we want
Yes.
to have everything clean and nice. So our body is a temple, and I like the way you are saying that we need to have a cleansing for the body done too, because the air we breathe, the food we eat, all those toxins that keep accumulating needs to be eliminated. The way you said
Yes.
elimination.
Mhm.
So my next question would be, who can have panchakarma? And you, as an Ayurvedic specialist and practitioner, you know that there might be some limitations and guidance about who can have it. And when you're describing Panchakarma, you said there are 5 ways you do the cleansing.
Mhm.
So, what is oil massage and all that? So I think I'm asking you 2 questions, and but you can choose to answer one by one. And
Yes.
I know that as an expert, you will have that
Mhm.
guidance for our viewers.
Yes. So when we say Panchakarma, it's a common idea for the people is it involves massage and steam. Yes, it involves massage and steam, but Panchakarma is not only about massage and steam. So massage, otherwise in the right word we call it as abhyanga,
Mm-hmm.
which is more therapeutic in nature because of the way it is done. The oil that is used is medicated oil, it's herbal oil. We have thousands of oils, different types in Ayurveda based on the constitution, which we pick according to the patient. And this Abhyanga is the prerequisite to Panchakarma. So it is not Panchakarma itself, it's making the body ready to receive the cleansing process. So what happens when we massage is the oil reaches into the subcutaneous tissues and it loosens up the toxins and keeps it ready to be eliminated.
Mm-hmm.
Okay. Yeah. And the second step is steam. So it's called Svedana in Ayurveda. So when we do the Svedana, the body warms up and the pores, skin pores are opened with the medicated steam. And again, you know already one of the ways of eliminating toxins is through sweat. So Ayurveda makes use of that mode of elimination through this Vedana karma. So the body is now ready, already oleated, already steamed, like sudated, and it's ready to let go of the toxins. So when we do that, part of the toxins go into the gut and part of it go towards the skin. So when this happens, whatever goes through the skin, it is eliminated through the sweating. And whatever goes inside the digestive tract or the gut, it is eliminated through the other Panchakarma procedures. So which can be Vamana Karma, which is emesis, inducing vomiting, or purgation, inducing a laxative kind of herbs we give to induce good elimination through the feces. And the third one, the most important one, is the enema. So, which is eliminating through the rectum. So, administering herbs in oil form or a decoction, a tea form to clean the rectal area. So, these three are done, and there is a fourth one we use as a nasal administration. So, the herbs in the form of oils are given in the nostrils. So, whatever doshas that are present, the toxins that are present above the head and in the region of the face and head are eliminated through this process. There is a fifth one which is called bloodletting, which is not done in the US at all. All right, so this is the basic of Panchakarma.
So I had a question about, I know that bloodletting was done in ancient times, but now it is not done because it's a procedure and usually not done in United States of America.
Yes. Mm-hmm.
What about Shirodhara? Is it part of Panchakarma or it's a different kind of treatment?
Yeah, Shirodhara is a modified version of Panchakarma. It is very, very popular in the United States and even in India. So it is done here mostly as a part of stress relief. So when the medicated oil is poured on the third eye right here in a certain oscillating fashion, and oil soaks all of your head and flows down in a particular way, we naturally fall asleep in the treatment. So it is a very good treatment for insomnia, and it is a beautiful stress relief therapy. And apart from that, actually going into the therapeutics of Shirodhara, it can help to strengthen the nerves, the brain, and all the neurons in the brain. So this is one of the treatments we use most for the people here because most of us are stressed because of work and other things, especially in this pandemic situation.
Great clarification of Shirodhara. Yes, can't wait to have it for myself.
Yes.
So my question is, because we all are so busy, everyone is tied in that time compartment, and the calendars are full. When you advise someone to have Panchakarma, can they have every part of the Panchakarma. They should have it in one session, or it can be done at different time, because sometimes they think, oh, I can get this one now and second one tomorrow. It's not like that. The Panchakarma is a set of treatment provided in one time zone, correct?
Yeah. So normally the practitioner decides which of these Panchakarma is good for you. Almost all of them involve the Abhyanga and Svedana, but the rest of the procedures the practitioner has to prescribe. So this is good for you. You have more doshas at this time of the year, at this part of your body, and we pick the right one for you and we do it. It's normally done as a course for minimum of 7 days for it to be absolutely effective. You can do shorter periods like 3 or 5 days, or even longer, multiples of 7, like 14 days or 21 days. But in the US, we mostly stick to the 7-day therapy because of the time constraint, and we try to incorporate everything in that 75 to 90 minutes every day for the best benefit of the client.
Wonderful. So, what do you do different in Panchakarma at Ayurveda Ashram, which I believe is in New Brunswick, New Jersey?
Yeah, it is in North Brunswick, New Jersey. And our Panchakarma, we try to incorporate acupressure points, marma points. I have learned something special from Siddha medicine called Varmakalai, which is similar to marma points, and some spinal adjustment procedures. Okay, so these are very special that I learned over a long period of time from different masters, and I try to incorporate those while doing the Panchakarma itself during the Abhyanga. So that is very unique and special to what we do at Ayurveda Ashram. So we do a lot of pain management where we use these marma points, the acupressure points. They come into real use, and that is why we are able to give the 21-day effect in the 7 days of time, because we incorporate all these techniques on the client on that same day.
Mm-hmm. So, for marma therapy, you expect that the patients or the clients they need to come for a longer duration, or it's individual based?
Yeah, it is individual. So when they come for the 7 days of Panchakarma, we try to incorporate all the marma points that they need in their therapy itself. So sometimes after the therapy, we teach them how to do the points by themselves, so they can continue doing them at home, so they can have the effect of the therapy for a prolonged period of time.
So, a question is, what kind of conditions are ideal for marma therapy? Because we know that pain management, this is, I think, the most of the patients, most of the people in any country, as they age, pain becomes kind of part of their life. As we age, our bones, our joints, they change. So back pain is the most common pain that everyone experiences at any point of their life. Disc herniation or sports injury. So I wanted to understand for our viewers, like what is the scope of marmas when you are applying the acupressure point?
Yeah. So when we are doing the acupressure points or the marma points during the therapy, it actually stimulates the energy channels in the body. Okay. Apart from just working on the muscles and the bones and the skin surface, these marma points directly work on the energy channels, so they clear the pathways. So normally when there is a block in the energy in any organ system, that causes pain. So when that channel is clear and the energy starts flowing smoothly, the pain is gone. Few of our clients, when we do marma on them, almost the pain is instantaneously gone. So any client with a disc prolapse or in the cervical region or in the lumbar region, and to varying degrees. I have had clients who couldn't walk because they were being carried to our center because they couldn't take one step, and they had steroid shots and they were recommended surgery and they didn't want to go for surgery, and before they would give Ayurveda a try. And these type of patients, we have helped them to walk almost the first or second day by themselves without help, using the marma points. I'll give all credits to the marma
Mhm.
because they work wonderful. And the oils that we use also is chosen so that the pain condition alleviates a lot. Yeah.
Yeah, that sounds very promising.
Mhm.
The question is, what is Kidzi Potli?
Kiri potli is
Okay,
a
is
bundle. Yes, kiri potli. It is a bundled herbs. We call it potli therapy generally. Kiri is a more South Indian term for that. So in a cloth, we bundle all this good pain relieving dry herbs and tie it into a bolus. And this is dipped in oil and heated on a stove top. And it is applied on the painful areas to relax the muscles and give more opportunities for the bone and the cartilage to align themselves. So when we do the skilly, you feel the relaxation like a heat pad application, but a more pronounced way because the herbs are also infusing into the system.
so on the same line. I also wanted to ask you if you could explain what is Kati Vashti. Am I saying it correct?
Yes, it is Kati Vasti.
Kati
Kati
Vashti.
Vasti. Yeah. So this is an external kind of Vasti where a artificial wall is made out of mostly flour and oil is filled in the area where there is a specific problem. So if there is a disc prolapse, we cannot apply too hard massage or anything on that place. So we just stagnate the oil in that place so that the oil penetrates deep and it oleates the system, and then it gives better chance for the discs to align themselves. So this is not only done in the back for the cervical or the lower back, it can also be done in the chest area. It's called Hrid Basti or Uru Basti. So what happens, we when we soak the oil in the chest area, it clears wheezing type of
Upper
lung
respiratory.
ailments.
Mhm.
Yes. It acts as a bronchodilator. So we have helped people with asthma by doing this Hrid Basti and helping to make the bronchodilatory effect on them and let go of inhalers, following up with breathing exercises. So that's very effective.
Thank you for explaining that. Another question was, when we age,
Mhm,
one of the most important part of our senses, our five senses,
mhm,
is our vision,
mhm,
what we see as a child. And as
mhm,
we grow, we know that there are changes in the vision. The cornea matures,
mhm.
so there is opacity of cornea. Is there any scope of all this therapy to improve vision?
Mhm.
Or we there is another condition, a lot of senior adults, they experience xerosis, a dryness of eyes. So how can Ayurveda assist in these conditions?
Yes. So the eye is the most important of our sense organs and it needs to be protected. And when we talk about vision, it needs to be protected. And the first thing is to prevent any conditions, and later is the treatment part. So we have to reduce the time that we our screen time and do palming and so many simple techniques, eye exercises to prevent eye disease. And also in Ayurveda we have this netra tarpana, which is nourishment of the eyes, where we keep a medicated kind of ghee in both the eyes, where it can nourish the eyes directly. So this definitely improves the vision and it removes toxins in the eye area and it also strengthens the optic nerve. So this has to be done on a regular basis every year, not after a disease has set in. Okay, and
So
even
it's
this
more
can be,
preventative. It's
it's
more
more prevent,
preventative,
yes, and nourishing.
nourishing.
Nourishing. So for children also this is highly recommended. So when we talk about Panchakarma, even when we own a car, right? So every time you see the engine light on, you know that you have to service your car, you have to change the oil, you have to change the air filters. But when it comes to our own body, we just take it for granted. In the office, if we want to work extra hours, we say, okay, and if we have to compromise on the time that we are resting, it's okay because we just take our body for granted and we do not, unfortunately, give it enough care and attention that it really deserves unless it puts you in some kind of a discomfort. So we really need to think about ourselves first, and as long as this body is functioning, then only we can help ourselves and others also in a better way.
I agree with that. That
Mhm,
along with all other karmas that we do in
mhm,
our daily life,
mhm,
it's really important that we maintain. Maintenance is very important. And
mhm,
on the Panchakarma that you talked about is almost like maintenance at the cellular level, the mitochondrial level.
mhm.
So I'm sure that there is also some guidelines, do's and don'ts when you have your panchakarmas. So if you can share some of those guidelines with us.
Right. So first step is we have to eat a really light diet. Specifically, it is to lighten the burden of our internal organs. So now you want your internal organs to do something else, to clean itself up. So if you want to clean your house, you take 2 days off and focus only on cleaning the house. So if you want the liver, your spleen, your stomach, your kidneys to cleanse, then you must not be doing strenuous work otherwise. Even watching TV is strenuous, I would say, because energy is constantly spent through your eyes. So, first of all, is enough rest. And then, or else, if it's not possible, at least keep the work minimal. And then the food we take, it should be very light. So, you have to think while you eat, how much time will my body take to digest this food? Is it really easy for me to digest this food? And the food has to be really simple and body should be able to convert it into energy.
Mhm.
So when we do that, the body's job of cleansing itself becomes very easy. Even though we do the panchakarma and we give you all good digestion herbs to make your digestion better, if you regulate your intake before 7 days and after 7 days, so a total of 21 days during the panchakarma, it will be the most effective one to do.
Mhm.
Yeah.
So it almost sounds like the diet and sattvic diet, the way
Mm-hmm.
you described it, which is very light,
Mm-hmm.
not too much spices,
Mm-hmm.
and a lot of water. I mean,
Mm-hmm.
I'm sure you have a description for those who are coming to you
Mm-hmm.
for Panchakarma and a list of food that they can eat.
Mm-hmm.
And everyone wants that Ayurvedic cleanse.
Mm-hmm.
That is a very popular terminology that I need the Ayurvedic cleansing diet. So
Mm-hmm.
I, as you explain, it goes hand in hand with Panchakarma.
Yes.
So thank you for explaining that. So before we end this interview, and
Mm-hmm.
I know that we have a second session coming up, I'm just letting our viewers know that we are not done yet. We have more coming in our next episode. Would you like to say something as a summary of this episode?
Oh, yes. Yes. So As we discussed in this episode, Ayurveda is whole person healing, and we have to give attention to us as a whole. We should not take our body for granted, and we have to give enough rest and rejuvenation to our body as and when needed, especially after 40 years. Every year, a 7 day Panchakarma would be highly beneficial, and it would show up in the aging process. So, aging is the most beautiful thing that we all will experience. And you don't want that to be like painful or, too much hospital visits and this sickness, that sickness. So, instead, it can be a very smooth and beautiful transition where we can give all of our wisdom and knowledge to the youngsters who come along. So, for this beautiful living experience, I would request all of you to take enough care of our bodies, minds, and souls, and also give a proper attention through cleansing. Also, every year through Ayurveda or any different methods that you know of. So, that is my humble request.
Thank you so much, Dr. Priya Baala. It was a beautiful message. And thank you for sharing your expertise in this episode, and especially about Panchakarma. We will continue our discussion in our next episode. Thank you for your time and expertise.
Thank you. Thank you so much, Varshaji, and thank you so much, TV Asia, and all the viewers for helping me bring Ayurveda to you. Right? Thank you. Namaste.
Thank you. So, dear viewers, it was a wonderful conversation with Dr. Priya Baala, and we learned about Panchakarma. And as I always say, always consult with your primary provider, who is your primary doctor, whenever you are thinking of including any complementary or alternative or holistic therapy in your therapy regimen. And as Dr. Priya Baala said, Ayurveda is not just when you fall sick. It can be part of your daily life. It is a preventative science, and it teaches you how to enjoy your life without getting disease. So use it as a preventative measure. And there is much more that we need to learn about Ayurveda. And we will continue this discussion in our next episode with Vaidya, Dr. Priya Baala. Till then, I will take leave now and say bye, your host Varsha Singh. Looking forward to see you next time on Healthline TV Asia Telugu channel. So continue to watch. If you liked it, talk about it, share it with your friends and family. So along with you, even they can use all these tips and enjoy their life and continue to stay free of disease. That is, stay healthy. Thank you.